We're going to be sharing with you a case where we plan on using pink ceramic restitution as part of the replacement of 4 missing teeth in the anterior region. Zimmer dental implants were placed according to a CT scan and stereolithic model. And we utilized this model, again, at second stage uncovering to secure the placement of the healing abutments and the soft tissue to coordinate with the laboratory's need for a butt joint soft tissue margin beyond the vermilion of the upper lip. What they require is a flat ridge in order to gain a very good thickness of tissue for the pink ceramic. So one of the things we want to do is to flatten the ridge utilizing Brasseler burrs for us to be able to use these gingivoplasty burrs to flatten the ridge, and then a laser is used to actually deepen the vestibule and remove the frenum. We're now going to use the original Surgi-Guides from Materialise to tell us exactly where the implants are subgingivally. So we're going to use them to guide us in the exposure of the implants utilizing stoma tissue punches. So we actually used the surgical guides that we had placed the implants with, and at second surgery utilized those same guides to guide the exposure in a minimally invasive manner, actually using these stoma tissue punches to guide us exactly where the implants are subgingivally. So 2 very important concepts is minimal surgery, and you can see these implants were small diameter or 3.3 millimeter implants in a narrow ridge. And we're now going to use the tissue punches to gain access to the head of the implants for impression taking. You can see now the flattening of the ridge in this area, which will allow us to have a very good margin, thick margin for the laboratory to be able to proceed with pink ceramics. And we realized early on with this patient pink ceramics would be necessary, and we wanted to ensure that the laboratory had a good thick flat ridge with keratinized tissue available and an adequate vestibular depth. Here is the placement of the Zimmer tapered screw vent impression copings that are going to be utilized to transfer the location of the head of the implants. And as we said before, the concept of a flat butt joint for the future pink ceramic has been created, as well as a deeper vestibule utilizing a CO2 laser vestibuloplasty. Here's the placement location of the 3 implants. You can see within the concept of the ridge. And I think you'll, in the future, be able to see this case taken through to the laboratory phase and an important part of our team, which is the pink ceramic restitution of deficient ridges. This is going to be a very big concept in the future, and here placing 3 implants to replace 4 missing anterior teeth. Come back later and see the final pink ceramic restitution of this patient.